and really pleased to have you online, to have you following, monitoring, getting information on our COVID updates, having discussions around the key data points. And of course, this is all aimed at providing for you the information so you understand, and your support as we galvanize all of society approach to dealing with COVID-19. Very who is coming to us live from Washington, D.C., the head offices of the Pan American Health Organization. And today, it's all about vaccines. Over the last week, the world has been abuzz around news of a particular entity that has had some successes in clinical trials around a vaccine for COVID-19. And many see a vaccine as the big hope to controlling the virus, to restore confidence around the public health risk that we have to respond to. And we thought that it was important for you to understand exactly what is happening as it relates to this particular vaccine, other efforts at the vaccine, and also looking at vaccines generally, because it is a point of discussion where there are views, opposing views in some instances around vaccine. And the right person to provide this update for us outside of our own team, who have done so in the past, would be the Pan American Health Organization, and in particular, its assistant director, who has responsibility to dealing with this. So we really want to say thanks to him, and he will come on stream to speak in short order. But before, and in the usual order, we're going to give a quick update on what is happening as it relates to COVID as of most current over the last 24 hours and before. And we're going to ask the Chief Medical Officer to give us that quick update currently. CMO.
Yes. Thank you, Minister. Good afternoon, everyone, and to the members of the team here and to our special guest. So I'm presenting the situation update for the country. We are now at 9,634 confirmed cases, with 506 imported cases, 9,128 locally acquired cases. And over the last 2 weeks, we have had 565 cases that would have been reported between October the 28th and November the 11th. For this period, over the last 2 weeks, what we see here on the screen is the chart that shows the distribution of those cases, which are our active cases, where the lighter color would have smaller numbers, and as the colors get darker, it is the increase in the number of cases. So still in Kingston and St. Andrew and in St. Catherine is where we would see the darker colors. But in terms of the numbers of cases, you would recognize, again, as I've pointed out last week, that in the western and the northern parishes of Westmoreland, Hanover, St. James, Trelawney, and St. Anne, we would be seeing an increase in the number of cases. That is where the pandemic is really showing its face at this point in time, while it is that on the eastern parishes and the southern parishes of Clarendon, Manchester, and St. Elizabeth, we're seeing a decline in the number of cases. Next slide. If we look at the rates by community, and why it's important for us to look again at this slide is because the top picture of the country shows the cases, where cases have been in communities right across the country since the beginning of the pandemic. And so what you will see is that almost every community across the country has been affected. Every parish has been affected. So the bottom picture will show us what's happening presently. And even though there's a considerable difference, we have to remind our citizens that what we are seeing, what we are recording, may just be the tip off, and is just the tip of the iceberg. And those are the active cases presently. But because we have had spread in all the communities across the country, it makes it possible that every single soul that you come into contact could be a positive case, and therefore you have to take precautions at all times. Here we look at the top 20 communities with active cases, and here again, outside of Kingston and St. Andrew, we will see Kingston and St. Andrew and St. Catherine, which are our largest populated parishes, and so therefore you're going to see larger numbers in those parishes. But outside of that, again, we will see that the western and the northern parishes are featured. St. James, Trelawney, I don't see Westmoreland on this one, but up to yesterday, a few days before, we would have had Westmoreland there. But St. James and Trelawney, St. Catherine is showing up quite a bit of cases here. And I just want to say that in the areas that we have intervened before in St. Catherine, it's very important for the persons within those communities to maintain their precautions, because we already see popping up again in the Greater Portmore area. More cases are coming up again, and we want to be able to stamp that out as quickly as we can. So this just gives you an idea of where those cases are across the country. Again, if we look at our national picture, the trend remains the same in terms of the national picture, where we do see a trend that is going down. But again, I would just want persons, when they look at this, to be very, very cautious, because we are approaching a season where we may see an increase in the number of cases. So we really want to get this number, we want this trend to go down almost as if where we were in July, so that if our cases start to rise at the end of November going into the Christmas season, that we would be starting off from a very, very low point. So precautions at this time is very, very important to get those numbers way down. And again, this shows across the island what the epidemiological curves looks like in all the parishes. And again, we can see that, as keep mentioning over and over, so that the persons within the western and the northern parishes recognize that even though their numbers may not be as large as Kingston and St. Andrew and St. Catherine, that they're at a time that they really have to take precautions, because those are the parishes that we are seeing that are looking very busy at the end of that graph, where those numbers are not trending down as we see in the southern and the eastern parishes, particularly if you look at St. Thomas and you see how St. Thomas has nicely come down, then that is where we want everybody to be. But not so in the western and the northern parishes. They have to really be taking precautions at this time. This is our weekly positivity rate, and again we are seeing a trend down in our weekly positivity rate, where for the last couple of weeks we would have been between 9 to 10%, and so far for this week we are at 7.2%. That may go up a little bit, or it may stay around that as the numbers come in for the rest of the week. But that 7.2% is reflective of the week as it is up to today. And this is where we look at the number of deaths that we have seen. And again, we see that the deaths track the confirmed cases. It lags by about 2 weeks behind, but we do see that it follows the trend of what is happening overall, in that we do see the number of deaths being reported now on a daily basis going down. And just to highlight again that it is our elderly population where it is that we would be seeing more of our deaths. Again, a precautionary word to our elderly population, and especially to those persons who would have comorbidities, that these are the risk factors for more severe illness, and certainly this is where we're seeing more of our deaths. And this is across parish. As you see, we have been seeing severe cases and deaths across all our parishes, so nobody is exempt. We all have to take our precautions. Here we want to point out, however, that there is a slight increase in the number of males over females that are having severe cases and resulting deaths. And this is a very important thing to note, because we know that men tend to wait a while before they seek care. And this is not just in terms of infections, but also in terms of chronic illnesses. And so we don't have the data yet to prove that, but it may be that our males are not taking care in terms of their chronic illnesses and therefore are at risk for a more severe illness. Certainly we are seeing that we are having more deaths in the males than in females. And that's the presentation for today, Minister.
Thank you very much, CMO, for that presentation. Thank you to our chief epidemiologist and her team for continuously updating in graphs and charts the presentation to make them as straightforward as possible. Remember, you can visit our website, the ministry's website, Ministry of Health and Wellness, for updates, our daily updates at 10 a.m., but also these presentations which we make available to the public. And it's all in aid of ensuring absolute transparency of information in order to give the public full understanding as we solicit their support around the COVID response measures. The general consensus, or certainly as shown in the charts and graphs, is that Jamaica is doing well in terms of the impact of the response. We see our curve coming down very nicely. We had community transmission. There are activities that led or contributed to that, which was somewhat anticipated. We're seeing now a decline in cases, decline in deaths, even having over the last week a couple of days when we have had 0 deaths. And that is amazingly excellent news. And it's just a good thing for us as a society to take some pride, and I'm talking now the entire society, because it really is up to every single one of us at all levels, that we see this positive direction of the COVID response. Having said that, we have Christmas coming on soon, the season. It is the season to be jolly, they say, an important calendar event in the Christian calendar. And we are a Christian country. Today I had a Zoom meeting with the major church umbrella organizations. We had a long discussion around the role of the faith-based organizations, the churches that are located in every single community across the country, in being a part of the solution. They have been up to date, and I want to commend them, our church leaders. But this Christmas season is normally the season when we have persons coming home, moving around, family gatherings, friends coming together, activities. I just want to say to the country, this Christmas may actually be a Christmas that has to vary in terms of some of those activities. Tomorrow, the Cabinet Subcommittee will meet, chaired by the Honorable Prime Minister, but with the presence of the team here. We're going to be discussing some of the issues around the season. What are some of the measures that we need to take? We will start to communicate those measures early once Cabinet signs off. And next Thursday, we're going to be focusing heavily, if not exclusively, on what are these measures, what are the expectations, what are the likely impacts, and how you can play your part in helping us to overcome the possibility of another surge in January or late December, depending on how things play out. But it's going to be a very important message, and I just want to put you on notice that it's something we need to bear in mind. So the level of conspiracy theorizing about vaccines appears to have reached in the last week or so. And new high as countries, including our own, work feverishly to contain the spread of the COVID-19 pandemic. With news that a new COVID-19 vaccine may shortly become available, the Ministry of Health and Wellness felt it timely to have a candid conversation, and I would dare say another conversation, because we've had a few, about vaccination in the context of this, our latest global public health challenge. The fact, ladies and gentlemen, is that vaccination has proven an undeniable success in the public health toolkit to reduce the burden of infectious diseases. Indeed, immunization, the process by which a person becomes protected against a disease through vaccination, is one of the most successful and cost-effective health interventions known to man. Vaccination has been tried and tested with vaccinations in use for more than 200 years. These are basic facts. Vaccinations have led to a substantial reduction of illness and death from diseases such as measles, diphtheria, whooping cough, and newborn tetanus. Through vaccinations, smallpox was declared eradicated from the world in 1980. Through vaccination, polio is on the verge of being eradicated. Vaccinations continue to save the lives of over 2 million children each year. And through the success of immunization, Jamaica had the last case of polio in 1982, the last case of locally transmitted measles in 1991, the last case of diphtheria in 1995, the last case of rubella or German measles in 2000, and newborn tetanus in 2001. Very important data, facts for us to know as a country, even while we take on the challenge of a COVID vaccine, to understand how vaccines have helped us as a population. And I've listed here some very memorable dates or years and associated ailments that have troubled our population, but through vaccines we have overcome them. So ladies and gentlemen, with more than 49.7 million people globally having become infected by COVID-19 and more than 1.2 million having lost their lives, vaccination as a response to containing the disease cannot be overlooked. Here in Jamaica, with more than 9,600 infections and 225 deaths, vaccination has to form a part of our COVID-19 response efforts. It is for this reason that Jamaica is among the CARICOM member states on whose behalf a down payment has been made by the Caribbean Public Health Agency for equitable access to a safe and effective COVID-19 vaccine through the COVID-19 Global Access Facility, or COVAX facility, and that even now there are ongoing efforts to raise the needed capital to create the cold storage capacity for COVID-19 vaccines within the region. That being said, we understand that given the pace at which the various pharmaceutical companies are working to get the vaccines to market, there may be concerns over the efficacy of the process, notwithstanding the clear and urgent need for a vaccine. And this is why it is so important for us to discuss in our usual approach to just ventilating the issues and facilitating understanding. We are very fortunate to have with us this evening our special guest, who I will introduce now, who I believe has some slides to put up and make a short presentation, and then we go into some questions. Dr. Barbosa da Silva, Assistant Director, Pan American Health Organization, live from Washington, D.C. Let me welcome you, Doc, and thank you on behalf of the Jamaican people and the Ministry of Health for coming online with us to share with us. You are, I am told, the expert on this issue as it relates to PAHO, and the floor is open to you now to give us your own views on vaccines and as it relates to COVID-19. Thank you.
Thank you, Minister Tufton. I think that it's more important to have a dialogue, so I will make a very brief comment about what's the situation now. And after that, we can take the questions and try to answer all the questions and that the journalists can want to present. But first of all, Minister, let me congratulate you for this initiative. I think that this kind of direct and transparent communication is crucial to keep all the population, the communities, the families aware about what is happening in the country, and at the same time, how they can help themselves to be protected, wearing masks, washing hands, keeping physical distance, avoiding closed the spaces. So many recommendations that we know that can prevent cases that can prevent deaths. As the minister mentioned, we have more than 1.2 million deaths related to COVID-19. So this is a very serious disease, and we cannot take it as it is similar to a cold or a flu. No, it's not. It's not, and we also clearly know that when the transmission is happening in a country, even in a developed country, if these measures to reduce the speed of the transmission, to reduce the spread, are not taken very seriously, the health services will be overwhelmed. The ICU beds will not be enough to provide care for the people that you need. This happened here in New York in February, in Italy. So even in developing rich countries, we need to be very careful, because when we think that everything is already gone and we are safe, we can face a new spike of cases, and this is really can be a threat to the health of the population of any country in the world. Minister, but talking about vaccines, as the minister has highlighted, vaccines are a very important tool that we have in public health, and we have everybody is expecting a vaccine against COVID-19. To develop a vaccine, the producers, they need to take time, and they need to make very important investments, because to have their vaccines licensed to be used, they need to perform many different tests in the laboratories, and after that, they need to test these vaccines in human beings. So they need to perform what we call clinical trials. Clinical trials, we have 3 phases. This is the standard procedure for a new medicine or a new vaccine. The first phase is to confirm that the vaccine is safe. The second phase is to confirm again, because it is very important, that it is safe, and to see if this vaccine is stimulating the production of antibodies. And the phase number 3 is the largest one. In general, the producers, they need to enroll around the 30,000 to 40,000 volunteers. Half of them receive the vaccine, the other half receive a placebo, and they watch very carefully for some months, and they see if people that got vaccine are more protected than the people that got the placebo. So this is a nutshell. After this, they need to publish this data in scientific journals. It's not only that they say, my vaccine is efficacious or my vaccine is safe. No, they need to publish in scientific journals, so the global scientific community can review the data, can see if they use the proper protocols, if everything is correct in the data that they are presenting, and they need to prepare a dossier that needs to be presented to the national health regulatory authorities in order to receive the license. So after the license, this vaccine can be released and can be used. We here at PAHO has a revolving fund that is a regional mechanism to purchase vaccines, that we are purchasing vaccines to our member states for more than 40 years now. And we have a very high standard of requirement about the safety and the efficacy of the vaccines. So we also require an extra step. The vaccines to be purchased through the revolving fund, they need to be also pre-qualified by WHO. So this is an extra guarantee that we have that the vaccines that we will purchase on behalf of our member states are the best vaccines available. As the minister mentioned, we are encouraging, supporting the countries to join COVAX facility. Why COVAX facility is important? We have now, today, 11 vaccines that are in this final phase that I mentioned before, clinical trial phase 3. We don't know what vaccine will finish this clinical trial earlier. We don't know what are the levels of protections that they will provide. We saw three or 4 days ago, the Pfizer, that is a big producer, released their press a paper saying that their vaccine is getting around 90%, but we need to review the scientific data, not only an individual announcement by a producer or 2 producers. We need to review the data. So these 11 vaccines, they can have different levels of protection. Maybe one of them will work better in elderly people, other one will work better with 2 doses every year, another one with 1 dose every year. So we don't know for sure until these studies are finalized and are published. So the countries that are making bilateral agreements with the producers, they are spending a lot of money, because nowadays the interest about the vaccine is so important for everybody worldwide that the richest countries, they are making commitments and they are trying to get the vaccine, and they are paying for this. But for a developing country to do that, it's almost impossible. For a poor country, it's completely impossible, because you don't know who is the producer that or which is the producer that you have the best vaccine. So you need to make commitments with 3, 4, 5 and paying for each one. COVAX facility, we work with all the producers. So we will have a basket. We are trying to get up to 15 producers. So it's almost impossible that many of these producers will not have a good vaccine, a vaccine that is safe and that is efficacious to be used worldwide. So this is the great advantage of the COVAX facility. We work with this basket of producers. We are releasing, we are starting the bidding process, PAHO and UNICEF. PAHO and UNICEF working together in a collaborative way. We are the 2 procurement mechanisms that will be utilized by COVAX. And we will, after launching this bidding process, we will receive formal proposals from the producers about the prices, about the volume of doses that they will have, what's the timeline, and other important information. But the one important thing to finalize and to open for questions and answers, Minister, a very important thing that the COVAX also is, maybe it's the main objective of COVAX, is to guarantee equitable access to a vaccine for COVID-19. In 2009, 2010, during the influenza H1N1 pandemic, the poorest countries in Latin America and the Caribbean got the access to a vaccine 6 to 8 months after the richest countries in Latin America and the Caribbean. So I think that it's very important that the COVAX, as the main mechanism to guarantee equitable access, can be able to provide vaccine for every country at the same time. So the idea is to have, when the vaccine starts to be deployed, to send a proportion that corresponds to 3% of the population of the country. Now, if a country has, don't know, 1 million inhabitants, this country would receive 30,000 doses, 30,000 doses in order to vaccinate the first priority group. Who is the first priority group? Health workers, because they are at the front line and they have a very high risk to be infected and to die due to COVID-19. Other social workers that are in the front line. After that, we want to increase until reach the correspondent of 20% of the population. With this phase, we can reach all people that have 65 and more years of age. We can reach people, all the adults that have hypertension, diabetes, or cardiovascular disease, or cancer, all the conditions that we know that are risk factor to develop severe diseases. So the main objective of this is the first phase. So the main objective of this phase is to save lives, is to reduce this disproportional burden that COVID-19 is bringing in some countries for the most vulnerable population. So after that, we, of course, we will go further and bring in other groups to be vaccinated. So this is the general picture. Jamaica has engaged with COVAX. Almost every country in Latin America and the Caribbean are participating in COVAX, and we hope that by the first semester of 2021, we will have the first vaccines being deployed to our member states.
So thank you very much, Dr. Barbosa da Silva. I want to separate the issues. Prior to this program, we did tease the public to inquire of them what concerns, what questions they have. So in a sense, I'm playing journalist here. I crave your understanding, asking some questions on behalf of those who would have posed those questions to us online and otherwise. I want to separate the issues. You addressed in the first instance the concept of a vaccine and how it is developed to ensure that it is safe. I, in my own earlier delivery, spoke to use of vaccine to eliminate polio and other diseases, measles, diphtheria, and so on in Jamaica. So we have had our experiences, and you helped us to understand that by suggesting the 3 phases in terms of the ensuring it's safe, ensuring it generates, I think you said, antibodies, ensuring that there is a test on humans, and you did say 40,000 have been given a placebo, and just for the public's understanding, that means given something that would have no effect on them. So it's not the vaccine. Am I correct, clinically, CMO? The placebo is really an administration of something that does not have any effect on the individual, while the other half would get the vaccine, and then we would test. Now, the news out in the media space is that in this instance with this particular company, they did just that. And in the case where persons were given the placebo, they had, and exposed to the virus, there were 90% persons who were affected by the virus. In the case where persons were actually given the vaccine, then 90% seem to have been protected in terms of from the virus, having been exposed to the virus. And hence the excitement around the possibility that we finally have a vaccine. But just to stay on point as it relates to the safety issues, there are persons in Jamaica, as I believe in the world, who feel that vaccines are not safe, that there are side effects that could be quite dangerous for those individuals. And, I go to the very extreme where persons argue that it's some conspiracy theory to support particular interests, large multinationals, wealthy families, big names, I won't call the names, and it's something that should be avoided at all cost. And I wanted to ask you just to quickly comment on the efficacy, if you will, of vaccines as a tool for prevention of diseases, because I think that is a big concern by a segment of the population.
Yes, Minister, I think that you are totally correct. We need to take into account that vaccines are the most effective public health tool that we have. As you mentioned, due to vaccines, we were able to eliminate polio in our region. We have eliminated measles in our region. We have saved thousands and hundreds of thousands of lives due to the vaccines and the vaccination programs in every country. And sometimes people think that the vaccine started yesterday. It's not true. Let's remember that this virus belongs to a family that is very well known, the coronavirus family. So since the first public health emergency related to a coronavirus in 2003, that the pandemic called MARS, the many producers and the research institutions around the world started studying how to have a vaccine against a coronavirus. So all this research now was expedited, of course, in order to face the emergency. But all the procedures are being taken account. No vaccine will be used if this vaccine is not produced in a good quality producer and it has evidence, scientific evidence to prove that it is safe and that it is efficacious. So we can ensure that this is a request that nobody is released due to the pandemic. No, we will review very carefully. The national regulatory authorities will review very carefully all the data that a producer needs to present in order to get their vaccine license to be used.
There are also the concerns about the pace of discovery and application to the general population, where persons argue that I am not going to be the first set of individuals to take that vaccine because the trials have not been long enough, and therefore chances of the vaccine having side effects that would have gone undiscovered because of time are real, and some go very extreme in that. How long does it take for a vaccine of this kind, or vaccines generally, to move from concept to market? And would one consider any new discovery of a coronavirus vaccine to date be too premature or too short in a time for it to be considered safe?
Minister, we have had a totally unprecedented effort to develop a vaccine, because this is a totally unprecedented public health emergency, a dramatic situation with more than almost 1.3 million people died due to COVID-19. But as I mentioned, since 2003, many producers have been trying to develop a vaccine against coronavirus. So now, when the COVID-19 started in January, they adapted their platforms and they started working with this specific coronavirus. So when we have now, by the end of the year, when they presented the dossiers to the national health regulatory authorities, these vaccines probably have been used in around 40 to 45,000 people that are almost every day monitored with clinical exams, with all kinds of monitoring. And so far, all the vaccines have presented mild side effects, as all vaccines can present. Some pain, the local, some people can feel a little bit, small fever. It is around 3-4% of people that got the vaccine. So these vaccines have presented the same levels of side events, and all of them are mild. because when happened, and this is public, when there was a suspect that the severe event had happened, the clinical trial was immediately paused until an independent committee of scientists can review and can guarantee that that event is not related to the vaccine. So I think that these vaccines will be a very important tool to save lives and to, by the end of 2021, if everything goes well, to have this pandemic behind us.
So you're saying, just to be clear, that there have been trials and research as far back as 2003, because the family of coronaviruses have been around for a long time, and modern science, or science generally, would have been searching and have made success from then. So the idea that it just has been a 8-month or a 6-month search is not necessarily true, because it has been building on information and research that has been taking place from before, and that's reassuring. I wanted to ask one more question before I get to the PAHO collaborative effort, which was the second part of your conversation, and that is the concept of a vaccine. People say that the vaccine is dangerous because it really is taking the live virus and injecting the live virus in your body. And I wanted you to explain that concept in the simplest possible way so that persons appreciate or understand whether, first of all, if that is the case, and if that is the case, you know, what is done to mitigate against the side effects that you say only 3 to 4% of persons would have, even if it's just a common fever.
Yes, Minister, we have different technologies that are used nowadays to produce a vaccine. The virus, the same virus that is producing the disease is never used, never. We have a vaccine that uses an attenuated virus, so it's a virus that cannot produce the disease, but can induce a person to produce antibodies against the virus. So these antibodies will be there if and when the virus, and when this person has contact with the virus. We have other vaccines that use the antigen is a protein that there is in the virus. It's not the virus, so it's not able to produce disease. And other vaccines are using new technologies, only genetic material of the virus. So all of these new technologies that are being used for these vaccines are cutting-edge technologies that have been used in the last decades for the very new vaccines, and they are proved that they are safe, that they are very safe. And for each new vaccine, of course, that we need to improve what we call post-market surveillance. So everybody in the world, every country in the world will be monitoring all the vaccines that are being used. So I do believe that these vaccines will be a very, very safe one, maybe more safer than the old vaccines that are still in use.
So again, to be clear, you're saying that the live virus is never used as part of finding a vaccine. It is, as CMO, what you were saying, you want to chime in here, just to be clear in terms of what the aspect of the virus that is used to determine or become a component of the vaccine itself.
Well, I think what Dr. Barbosa has been saying is that you have different types of vaccines, essentially, and different vaccines are formulated by, in different ways. So you may have an attenuated virus where they change something to make the virus not able to produce disease, or you may have part of a virus. So it's never the virus in itself that can produce disease that makes the vaccine, but maybe some part of, or an attenuated or changed virus that is not it will produce a response for the body to produce antibodies, but will not produce disease in the patient.
So the real issue is for Jamaicans to know, and those others listening on, is that the live virus, the COVID-19 virus, would never be and is not a part of any vaccine that is used to treat COVID-19. That's as I'm trying to be as simplistic as possible to avoid any misunderstanding.
Minister, please allow me to, and this is not new in vaccines. The vaccine against measles that is used for many, many years now uses this attenuated virus of measles. And other vaccines, they use a kind of a dead virus, the vaccine against influenza, for instance. So no vaccine uses the virus that can produce a disease, because this is not a vaccine, this is a biological weapon. So it's not allowed to be used at all. So I think that it's important that when the vaccine is available, we cannot lose this opportunity to protect our lives, to protect our family, because this COVID-19 is a very severe disease for elder people, for people with health conditions. So we cannot let this kind of conspiracy theories, rumors that have no basis in the real things that are being done very seriously about these vaccines, can prevent us to have this vaccine.
Thank you for that. Now, the final question I wanted to ask before we go into any questions that may be online is the access to, assuming a safe vaccine is determined on, the signals of which are being sent based on trials that are happening. How long would it take for a country like Jamaica, given our COVAX program that you spoke about involving PAHO, the group purchase, if you will? We have contributed to having 10% doses, or the equivalent of 10% of the population, I think 27 or 30,000 doses of the vaccine. And we have said to the frontline workers, as you have said, how long would it take if a vaccine is successfully announced today? How long would it take for production to catch up with demand and a country like Jamaica to have access to that vaccine?
Minister, we are expecting that by the end of November and the end of December, many of these 11 vaccines that are already in the final phase of the tests are finishing their tests, the clinical trials. They will publish the data, and they will present the request to receive a license. So, and after the license, they need to produce the vaccines and start deploying. If everything goes well, our expectation, we cannot be 100% sure today, because we need to wait to this process being finalized. But we expect that by during the first semester, maybe by March, we can have the first deployments of vaccine. And the idea is that every country that had joined COVAX facility, and Jamaica is one of the participants of COVAX, will receive the vaccine at the same time. This is what we are calling equitable access to the vaccine. So the frontline workers of Jamaica will be protected. After them, elderly people with health conditions, and after them, all the priority groups that the Ministry of Health of Jamaica will make a decision.
So you're saying that by the end of this year, we should expect some of these companies, you say 11 attempts at a vaccine, to file for or request for approval of their vaccines based on trials that are being conducted now, and that by end first quarter 2021, we could see some sign-off on these applications, or some of them, and then production for delivery by end of first quarter, or not too long beyond that. I mean, is that an optimistic assessment, Doc? And there are many who feel that we have to wait another year or two And are we, and I have to ask this question, it's not an indictment on PAHO, yourself, or anybody else, but it's being asked by people. Is there a rush because of the need for a solution that may actually compromise quality and or we're creating hope where that may not materialize? Just give us some clarity on that, because people do ask that question.
No, this is important. Means I think I'm optimistic, but I'm not saying that the vaccines are ready. Even this vaccine from Pfizer and other producers that are saying that the interim results are very good, that they are reaching a very good level of efficacy. We are not taking the interim reports. We want to see all the research, all the clinical trials to be finalized, following the standards that are used for every vaccine or medicine. Every new vaccine or medicine needs to perform all these tests, and after this, the review. This is I think the right way to proceed. We cannot take any. We cannot compare the quality of the production, safety, and efficacy. So I expect that some around March or April, we can have the first deployment of the vaccine.
Okay, thank you very much, Dr. Barbosa da Silva. Really appreciate your coming on behalf of PAHO, WHO, to give us here in Jamaica and beyond, because we're being streamed live all over, this information around vaccine. The conversation, I'm sure, will continue because there is a lot of hope that is vested in the need for a discovery, but there's also a lot of cynicism and concerns and curiosity as it relates to the vaccine, and you've helped us to understand and appreciate more some of the issues. We have been saying it here as public health, but it's good to hear from another voice, from another place, and from your perspective or your institution's perspective. We're going to ask you to hold the line, because we're going to now turn over to Stephen, our public relations, our communications director, to allow some questions, and some of those questions may be directed at you. So, Stephen.
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to ask your questions to the panelists. We're going to begin with Brittany Clark from Nationwide.
Hello, good evening, everyone. So my question is pretty much an update on the convalescent plasma therapy. I know that the UE is a part of is conducting a clinical trial, but I really just wanted an update on the process. Does the ministry have anything positive to report, or anything at all to report as it relates to the effectiveness of the treatment, or of exploring that treatment for possible use rather for COVID-19 patients, as well as has the health ministry responded to the UA's request to aid them in sourcing recovered patients to participate in the trial? And since we have Mr. Barbosa here, is it possible as well to give an update from the world perspective? I know India is a part of the trial, clinical trial as well. Just give an update on what the results are so far. Thank you.
Okay, so the question then goes firstly to I'm going to ask the CMO to respond to an update as it relates to Jamaica, and then we ask Dr. Barbosa da Silva to speak to us on what the global perspective is on this plasma treatment for COVID. CMO first.
Hi, good evening, Brittany. We have not yet received any update from the university hospital with concerns with respect to the study, the plasma study. So I'm not able to provide an update on that.
Okay. Sorry, Dr. Barbosa da Silva, I hope you understand the question that was asked, but it's concerning the use of blood plasma from patients who have recovered from COVID, where that is provided to patients who have COVID and maybe in an advanced or more critical state, as part of the clinical response. Is there a perspective on that from WHO view?
Yes, no, thank you for this question, Brittany. But unfortunately, I fully agree with the CMO. The situation is not only in Jamaica, but many hospitals and centers in the world are trying different strategies, medicines, treatments. The plasma, coalescent plasma is one of them. And it has been used for other diseases here in Latin America, for example, in Argentina, I don't know, 20 years ago, for an hemorrhagic fever that was there. But so far, we don't have a final result that you can say we can use and we can recommend this use. So we are encouraging more research in order to recommend only when we are sure that this will really benefit the patients.
So
what we know so far, and it's very well established, as the use of dexamethasone, for instance, when patients that need oxygen support, the use of dexamethasone can reduce around 30% the mortality. This is being recommended already.
Okay, thank you. Two questions that came in earlier when we asked persons to field questions, Doc. One is on the concept of herd immunity. This idea that the virus will eventually move through the population, and the quicker it does so, the better it is in the sense of building up the immunity. Can you comment on the concept of herd immunity and whether that works or not? And then I'm going to ask you another question around the issue of the surge or the resurgence of the COVID cases in countries which have gone through one phase, and whether that has established any particular pattern or any more serious threat of the COVID once it gives you a second surge. But the first issue of herd immunity.
Thank you, Minister. This is important. I think that unfortunately there were some debate about herd immunity. But first, when we don't have evidence about what is the level that will guarantee herd immunity for COVID-19. So some researchers are saying, no, the herd immunity was already reached in Europe, and now we are saying a second wave, very important one, in the same countries that some people had claimed that the herd immunity had already been reached. So I say that the herd immunity is not a strategy; it's a tragedy. When we see the data from New York during that first wave in February in New York, if the city of New York had adopted the social distancing measures 2 weeks before, they had in New York only, they probably had prevented 36,000 deaths to happen. So we cannot think that this is a kind of experiment. We are talking about human life. So we cannot make an experiment with the population. We don't know what is the level of protection that will guarantee herd immunity, because the concept of herd immunity is that if, I don't know, 60% or 70% of the population have already had contact with the virus and the antibodies, they will protect the others that have not been protected. We don't know for sure what is the level that is required for COVID-19 yet. And second, if we need to gamble on this option, the price to pay will be very high. Will be many thousands of lives that will be in a, I don't know. It's a tragedy to think about it. That the only country that I know that tried this strategy, that was Norway. The mortality rate in Norway is 7 times higher than the Nordic countries. So I think that, again, it's not a strategy. You cannot think about that. When we have the vaccine, this is the time that getting people vaccinated, we will reach herd immunity.
Thank you very much. So the concept of herd immunity as a strategy, Paho is saying, is not what they would recommend at all. And similarly so in Jamaica, by the way, we have never pursued a course or a strategy that considers achieving herd immunity as overcoming the vaccine. Stephen, you have another question?
Yes, I have two questions from Debian Wright from the RGR Gleaner Communications Group. She's asking, is the ministry current as it relates to the testing of COVID-19 samples? And will the ministry be launching a public education program to get skeptical Jamaicans to take whatever vaccine is eventually approved?
I'm going to ask the CMO to deal with the first question on the currency of COVID testing.
Yes, we are in fact current with the COVID testing. Remember, however, though, that our turnaround time is about 48 to 36 hours. So that is what current means. While it is that we will provide some results within 24 hours, that is not the routine delivery within 24 hours. So urgent samples will be done. In terms of we have an implementation plan that we have started to look at in terms of the vaccine rollout. As with every vaccine, there are a lot of things to do even before the vaccine gets here, that we have to sensitize the public, we have to sensitize our healthcare practitioners, and we have to look at the actual logistics of getting the vaccine out. So all of that form part of an implementation plan that we are presently working on. And yes, a public sensitization campaign will, of course, be a part of that.
I want to say, as it relates to a public education program, this is going to be very important, particularly as we approach the Christmas season, because of the likelihood of traditional movement being increased. And we have to get the public to come to terms with a particular approach to recognizing that the virus is out there and that we have to take whatever precaution that there is. You have another question? Stephen, go ahead.
And another one from Debbie, and she's also asking, are there any surveys being done now to see how many Jamaicans would be willing to take the vaccine?
Well, we have not launched any actual official surveys. Of course, we are seeing the feedback that is being provided on social media, etc., in terms of acceptance of the vaccine. As Dr. Barbosa said, in terms of the initial distribution of vaccine, it is going to be along the lines of our influenza plan in terms of the persons that are most vulnerable and most at risk for spreading to other persons, which would be our healthcare workers who would be in vulnerable institutions where you may have persons with the virus. So they are at high risk of getting the virus. They're also at high risk for passing on the virus to other persons. And so healthcare workers would be our first area of vaccination. And then, of course, we have our vulnerable populations. That would be the next tier of persons. So those are the persons that would initially be catered for in terms of receiving the vaccine.
Okay, I don't know if Dr. Barbosa da Silva wants to come in here. I think our time is up in terms of questions and discussion, but I want to just thank you again for participating, and thanks to PAHO for doing what we are dependent on to overcome this COVID-19 in this region of the world, as indeed in the world. I think your information was quite important, and we really appreciate your contribution. You have any closing remarks that you'd like to leave with us this evening here in Jamaica and for those who are looking online?
Just to congratulate you again, keep this kind of candid conversation with the population. I think that people are taking advantage of social media to share rumors, and the best vaccine against the rumors is to tell the truth, to show the facts, to show the evidence, to show the studies that will be published. So the families will see that the vaccine will be the most important tool to end this dramatic pandemic that we are living. Thank you.
Thank you very much again. Best wishes to you and the PAHO family as we continue to work together to overcome COVID-19. Well, there you have it, ladies and gentlemen. We had some information around vaccine to reinforce what we have been saying here in Jamaica. We have benefited a lot from vaccines. In the past, I gave what I thought would be convincing information around the extent to which vaccines have been an important solution to challenges that we have had. Immunization with polio, 1982. Last case of locally transmitted measles, 1991. Last case of diphtheria, 1995. The last case of rubella or German measles, the year 2000. And for newborn tetanus in 2001. Now, people, we all need to understand that in the context of human development, when you look at mortality rates, when you look at life expectancy, it is because we have been able as a people, as a country, and indeed as a world, to overcome some of these life-threatening ailments that has allowed, some of the achievements that we recognize and we celebrate. As I said, life expectancy, human development, and by extension, the links to economic activity, individual and collective productivity, all linked to our health care, our health profile, our health status. And vaccines have featured prominently in that conversation. And I think it's a message that we must project. I think it's a message that we must repeat, and we must push back on the anti-vax movement, those, whether with resources or otherwise, who use the platforms that are available to them, mainstream or non-traditional media, to promote this idea that vaccines somehow are dangerous. I've had many vaccines, and I think I'm fine. And I believe most of us, or all of us here in this room, and certainly as a country. So PAHO has reinforced that, and we want to thank them for the partnership. I also want to say that a significant announcement coming out of today's COVID conversation is that PAHO is projecting, that we could possibly, and I put it no stronger than that, have a vaccine by the end of the first quarter of next year. And that, to my mind, would be a significant game changer in the COVID response, because 2020 has been a year to remember, with everyone speaking about a solution, but we could only focus on containment. And the world, of course, has been worse off for having COVID-19 from a number of perspectives. So if in fact we can get access to a vaccine by first quarter next year, it would certainly begin to change the conversation, the COVID conversation. It would certainly begin to restore some sense of normality to the population, and clearly would provide hope that there is light at the end of the tunnel, if you will. Until then, however, I want to, on behalf of the medical team here, and I believe PAHO and others, encourage Jamaicans and those others listening to keep observing the protocols around containment and prevention. The mask wearing, the physical distancing, the sanitization, because vaccine or no vaccine, the truth is the world will always be threatened by an emerging public health issue for one reason or another. And I believe COVID should teach us that issues around infection prevention and control must become now the norm than the exception. And until that vaccine is available, we must continue to push for observing those protocols. And I think that's an important, cautious note on which to end. While we are hopeful, we continue to observe and to respond in the way that we know and in the way that has worked for us for the most part here in Jamaica and the world. Ladies and gentlemen, I want to thank you for joining us today for another COVID conversation. Today, Thursday, the 12th of November. Next week, we will see you again, where we'll continue the conversation. And I am suggesting that we will have a conversation around the upcoming holiday season and some of the risks and some of the responses that are necessary or will be necessary to manage the COVID spread. Thank you very much, and enjoy the rest of the week and into the weekend. Thank you.